I'm Dr. Arun, Senior Consultant and Head of Department of Anesthesia, Critical Care and Pain Management. Now, you would be wondering what an anesthetist does and who looks after you during your surgeries. Now, we are an integral part of the hospital and look after patients in operating theatres and beyond. But the first time you would hear of us or come in contact with us is when your surgeon says that you need an operation. What normally would happen is the surgeon would either admit you or ask you to go and meet your anesthetist. Now, it's very essential that you know who the anesthetist is and you meet them well in advance. A lot of preparation is needed for even minor surgeries depending on how old you are and what your other medical problems are. So meeting an anesthetist will actually benefit you by realizing what can be changed, what can be improved in your general health, and what other investigations you would need prior to having any surgery done. Now, an anesthetist is not involved just in the operating theatre. We look after you well in advance, prepare you for your surgery, talk to you about what kind of surgery you're going to have, what kind of anesthesia you would be given, and how your pain relief will happen during and after the surgery. Now, when you wake up, the only two things you wonder about is, has the surgery gone well and how much pain I am in. So it's a 50% collaboration between the surgeons doing a surgery well and us anesthetists looking after you so that you're completely pain-free when you wake up and comfortable. Now, a lot of surgeries are done nowadays under general anesthesia, that is, you're asleep during surgeries, but a frequent number of surgeries are also done by doing some local or regional anesthesias. This allows you to stay awake, even watch your surgery if you're interested, and be ready for discharge much earlier than having a general anesthesia. So these are things which your anesthetist would be able to tell. So it's essential that you actually go and speak to them well in advance of your surgery dates. Now, we are not involved just in giving anesthesia. A lot of patients who get admitted into hospitals come across anesthetists for various other reasons. If you have problems in getting drips into your hands or IV access, an anesthetist is called. If you have problems in getting blood samples and it's very difficult to take blood samples, an anesthetist is called. So even patients admitted in hospitals, otherwise not for surgery, would have an anesthetist visiting them. If you're admitted and you're having an endoscopy or a colonoscopy or a bronchoscopy, any kind of procedure you're getting done outside the operating theatre, you may want to meet an anesthetist because we can make your life easy. You can be sedated, you can have a comfortable bronchoscopy or an endoscopy done with absolutely no remembrance of the whole procedure and being comfortable throughout the procedure. So we do help out with all these procedures. Similarly, a lot of patients find it difficult to lie down in the CT scanner, or they're afraid of going into an MRI scan. Now there again an anesthetist would be your help, because we would be able to sedate you and keep you comfortable during the procedure and during your scans. Now, beyond this, we also tend to look after the intensive care unit in most of the hospitals. And if you or your loved ones have ever been in the ICU, you would have seen an anesthetist or an intensivist being around there looking after your health. They are there 24/7 to look after you in an intensive care. Beyond intensive care, we also help out in chronic pain. We also manage the chronic pain clinics, where if you've had problems which have been long-standing, you need medications which are long-standing for pain, or you need procedures being done for chronic pain, it would probably be delivered by an anesthetist. So overall, in a hospital, you would probably come across an anesthetist in various forms and fashions, whether it is for surgery, whether it is just for taking some blood samples, or looking after your critically ill ones, or even helping you out with chronic pain. Now, 16th of October is remembered throughout the world as World Anesthesia Day, primarily because the first anesthesia was given on 16th of October, and since then there have been rapid progress in the way anesthesia and critical care is handled by the anesthetist. So next time you are on a hospital visit or any surgical procedure, make sure that you met your anesthetist and discussed all forms of anesthesia and what you would need for that surgery and well beyond the surgery.